the past few months in the Washington, D.C., Maryland, and Virginia areas, the Black and Brown, queer, transgender, and non-binary communities have experienced multiple different losses to substance use. Individuals directly and indirectly impacted by this issue all came together as a part of the National Trans Visibility March's Community Advisory Board to create a campaign to raise awareness about this issue. Those individuals created a campaign titled Our People, Our Purpose. The message behind this campaign is meant to promote the necessary community that individuals need, family, chosen family, biological family that individuals need in order to make sure that they stay safe.
It would mean unity, and it would mean change. It would mean change because the one thing that's the problem in our community is division. And coming together, we would make such a powerful impact on the world as a whole, just being one.
When I say trans, you say power. Trans 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 power.
Hello. Welcome, everyone. We are so glad to be here today to discuss a little bit about the drug epidemic crisis in our communities. Thank you to everyone for joining us for the National Trans Visibility March and from One Orlando Alliance. My name is Caleb Barton. I use he, she, and they pronouns. I am one of the steering committee members for the National Trans Visibility March, and I help lead the Our People, Our Purpose campaign that is all around opioid use in the trans and gender non-conforming communities. I will pass it over to Courtney to introduce yourself.
Hi, everyone. My name is Courtney Peters. My pronouns are she and they. Thank you so much for allowing me to be here today. I'm very excited for this conversation. I serve as the program coordinator, the mobile program coordinator for Orlando's Surrender Exchange, Idea Orlando, which is housed under Hope and Help.
Michael?
Hi, everybody. I, too, am really excited to be here today to talk with you about this really important issue. I work with Health HIV, which is a national nonprofit based in Washington, D.C. And of course, as our name indicates, we do HIV, HCV, viral hepatitis, and LGBT health work nationally, but also opioid work. And I also run the Opioid Learning Institute based in DC.
Thomas?
I'm happy to be here as well. I'm appointed by Mayor Demings to oversee the drug-free office in Orange County, and we are currently focusing a lot of our attention on opioids. Unfortunately, we're seeing a lot of unnecessary death and mourning based on the accessibility of low-cost opioids in our community, and I'm certain it's happening in communities around the country. And so happy to be here to represent Mayor Demings and look forward to the conversation.
And I'm so happy to have you all. I'm looking forward to this conversation. One of the things that I always like to just start the conversation off with is kind of like the purpose or motivation. It's so important for us to understand exactly like the story or the journey that we may have taken to getting to the positions that we are now. And where the passion is that is behind that led us to being the people that we are today. So if you all could just share with me, what is your why? What is your reason for being involved in harm reduction work and addressing drug use in our communities overall? Courtney, you can start.
Yep, I was like, should we go the same way? I just want to make sure. Yeah, so I think for me, everybody knows somebody who's been impacted by the war on drugs or by the opioid crisis. And I think Growing up, I was definitely around a lot of drug use, a lot of alcoholism in my family. And I always had a huge problem reconciling the difference between somebody using drugs and my dad. And I just always thought that it was weird that those had to be two very different categories. And then growing up and seeing the way that both my family on both sides, both from the white side of my family and the black side of my family, because I'm mixed, were treated extremely differently for their drug use. And then getting a little bit older and then having my own struggles with substance use and living through that experience all brought me in this big circle back to handing out Narcan in Greensboro, North Carolina, which very quickly led to handing out needles from a trunk in Greensboro. And it was really the first time that what I was doing aligned with my home and my community. And I just haven't stopped since. So I do this work every single day to break down those weird boxes in between the word addict, which shouldn't exist, and people's actual titles, which are just people and parents and friends and loved ones, and to have that conversation about how to bridge that gap, basically.
Thank you. Okay. Michael?
Well, that's a really big question, and a big answer to follow Courtney there. Um, I grew up on a dairy farm in rural Pennsylvania, and I was at the time I wasn't an out gay man, um, and I suffered a lot of depression, harassment, bullying from people in my community. What I called my friends, use that quotes there. Um, and as I was matriculating through my college journey, I found this great field in public health. And I was attracted to the HIV fight due to my friends becoming infected with HIV and passing from HIV. And wanting to make sure that people have the information to make informed choices and informed decisions is so important to me. And I always find it very interesting in our work that we sometimes think that harm reduction, part of what we're talking about today, is normalized everywhere, and it is not by any means. That people always see it as abstinence or you're not. And there's an entire continuum there that I want to make sure that individuals know they have the information and resources that they're able to access. And that's what I love about my work, because every day is a new day, every person's a new person, and on their own journey. And we may just intersect momentarily, but we want to make those intersections impactful.
Yeah. Okay.
So I started out in this work as a sort of an adolescent rebellion. My father was a sergeant major in the Marines, and I decided early on being a social worker was as far from the sergeant major in the Marines that one could get. Ironically, when he retired, he sold real estate, and he was written up in the newspaper as the social worker of real estate because he helped first-time buyers get homes. So that crushed me a little bit, but it also, it's funny with age. I had a whole new appreciation for him and how his life shaped him as well. His mother was an alcoholic, and he was abandoned when he was 2. And so I've always had a heart for children. And my early career, I worked in at a children's home. I was a house parent, and I got into the substance use field by accident. I was working in a big facility, and they had this dual diagnosis program, and so I remember asking if I could work in it, and I was told, well, you can only work in it if you're in recovery. And that just seemed odd to me, because I'm a big believer in, if you truly accept people and you're willing to learn from them, you don't necessarily have to have the firsthand experience. And so I remember commenting to the person in charge, I work with the thought disordered patients, and nobody's asked me if I'm schizophrenic. So I don't understand what's so special about this population. So that was my introduction to the treatment world, and that was in 1992. So there's a lot that's happened over that time, and I'm so happy to hear that harm reduction is a word that we can talk about. I remember the first time I shared a plan to utilize harm reduction with college students. I had to couch it as risk and protective factors, because harm reduction was just too toxic. But that's what we did. We did a lot of work on teaching how to things you can do to avoid harm. And so here I am, some 30 years later, and really love what I do, and the opportunity to actually have a whole community as my patient.
Yeah, I appreciate that. So this concept of harm reduction, there has been quite a shift. I would say there was a lot of resistance around approaching harm reduction in HIV and in drug use and everything. There's still even some challenges and some opponents with in as it pertains to HIV, just like the notion of treatment as prevention, and like spreading that knowledge. And but I think there's a lot of challenges when it comes to folks actually adapting it and truly making sure that's a part of like the societal norm, because that's a difficult shift to actually happen. So, as it pertains to harm reduction, can we talk about what are some of the challenges with actually permeating the social understanding of harm reduction, and what are some of the things that folks who may want to help people move past their challenges or their resistance for harm reduction, what are some of the things that they could potentially do to support those individuals? Anyone can
Well,
jump
I
in
think
here.
Michael brought up a great point about the continuum. It's not abstinence or use. There's so much room in between, and I think that's one of the challenges. For so long, people have associated recovery with abstinence, and that's just not the case. There's a lot of room, a lot of ground to travel between abuse and abstinence, or in and use. And so I think that's something that we have to navigate when we're communicating to the general public what this means, because I still think in the consciousness of people who don't have daily contact with someone with a substance use disorder, they tend to think in those very concrete dichotomous terms.
Mm.
And I was going to say that I train a lot of providers nationally, and harm reduction is a term that they may consciously know, but they don't think of their work necessarily as harm reductionist in the sense. But everyone practices harm reduction every day, whether I cross the street when the walk sign is lit, or I decide I'm going to jet across, with the stop hand, or I decide whether I'm going to eat a salad or a burger for lunch. Like, these are all examples of harm reduction. And one of the challenges that I think that we experience in substance use and sexual health work is that we're talking about topics that haven't really made their way into normalized conversations, and people really talking about their struggles and their concerns. And we've looked at these issues as substance use or having sex as being negative or bad or not the norm, in which they are the norm for many of us. And I think that helping people to make that transition, that we need to normalize these conversations and be open to share experiences. Just as we started today, like what brought us to this field. We need to talk about, how things are impacting me as a person and how I'm responding to those things, whether they're good or bad, ways to deal with them.
Yeah, I also think that there's a lot of really specific things that people have in their minds when it comes to not just drugs, but people who use them. There's a really good thought exercise that I love to use with people when, especially college kids, when I go talk to them about, how many of you had coffee this morning? Okay. How many of you drank last night? How many of you did heroin yesterday? A lot of jumps there, but let's talk about drugs. Let's talk about what they are and what they do. And let's talk about how we interact with them every day and might not think about it. And I think that's a really good way. And then also challenging yourself. When I say a person using drugs, what comes to your mind? Because I think we also can't have this conversation without talking about a lot of bias that comes into it and a lot of the racism that the war on drugs was built on and a lot of transphobia and all of those things that got us where we are today, where people are either chaotically addicted to drugs and cannot function, or not using drugs, but really using drugs and just having housing and healthcare and money and all of these things that allow them to be comfortable while using. And that is a really hard conversation to have. So for people who are new to harm reduction, to people who are trying really hard to understand or trying to help their family understand both what Thomas and Michael said. I mean, you practice harm reduction when you put a seatbelt on. You practice harm reduction when you choose not to have another glass of wine because you have to get up at 5 a.m. and you'll be hungover and you don't want to be. These are all choices we make to feel better. And harm reduction is just any positive change that is helping us feel better. And that might include drugs and that might not. And that's completely okay. So moving past the mindset that drugs are always bad, nothing is black and white. We talked about the continuation of use, and that continuum is so important. A lot of people live right in the middle, or you live at different places at different points in your life. And we don't often get to talk about that. When we're talking to folks who don't understand, we don't ask them to think about what they were doing when they were a freshman in college. They were probably drinking, they're probably having a lot of fun, and then they weren't. And okay, why did that happen? Did that happen because you were able to graduate and get a job and make a steady income and have stability? What about people who don't have that option? What do you think would have happened? And just talking about all of the things that circle around drug use and can really impact how we use drugs, like housing, like healthcare, like all of those things. And just having that conversation about the fact that it's 9 times out of 10 not the drug use that's the problem. There's something else going on there that needs to be addressed.
Right.
And just quickly, I want to add, I think it's important to elevate this conversation beyond us to leaders and decision makers, because that's where a lot of that bias resides. And I found a lot of the times that bias resides because they've had a negative experience with someone who used substances. And so that becomes seared in their mind. And everybody who uses substances is now defined by that one person who hurt them.
Yeah, it's the danger of living on the binary. Just to draw the connection back to us being in the National Trans Visibility March, when we think about drugs, there is this large, vast spectrum of experience, and the whole notion of the functioning drug addict. That thing, that person does exist. There are plenty of those individuals, and I oftentimes, when I'm talking about drugs to individuals who are very resistant, I often tell them it's like there are people who are using drugs that are in charge of making our policies. They're in charge of enacting our policies, and those individuals are not persecuted for their drug use because they aren't living impoverished. And nine times out of not may not be Black or brown individuals, which brings me back to your point earlier, Courtney, around your why and how one side of your family, being the Black side, being persecuted a little bit differently from your white side around drugs. Could you talk a little bit more about the implications that race has had on the the war against drugs, and the approach that folks have taken in the reaction to the drug epidemic overall?
Yeah, I think just starting off with that last point, the reaction, I think that it's not a huge stretch to say the reason the opioid and overdose crisis are so important right now is because white people started dying. It's been happening for a long time, but white people, middle class, upper class white people started dying, and then we realized it was a problem. And that was by and large because we saw a spike for a little bit of time in prescription opioid overdoses. That's, to be clear, not the reason the opioid crisis exists, but people that had access to healthcare were getting these medications and dying, and then all of a sudden it was a much bigger deal. When really people in Black and brown communities have been dying from overdose and over policing because of drugs for decades, and it hasn't been on anyone's mind. It's absolutely no secret that the war on drugs was based on race. It took until 2021 to have crack cocaine and cocaine charged as seen as the same drug legally. That literally just happened this year, and it was because cocaine existed in one community, a white community, and crack cocaine existed in another community, the Black community. So you can't have these conversations without talking about it. And me growing up, seeing it in my family, seeing that one side of my family, my cousins had to worry a lot about having literally maybe a bowl with some weed on them. And then other sides of my family, my cousins were overdosing in parking lots and never getting arrested, but getting help that they needed. And I'm not upset that they were getting help and not getting arrested, but it did make me have to think about why one half of my family was so scared and the other one wasn't. And seeing that growing up really informed a lot of my decision making around the war on drugs. And I think it has to inform a lot of our conversation, because we're doing a disservice if we're not talking about the fact that the war on drugs was racist, and we're not talking about the fact that that medical racism still exists, and therefore a lot of time folks of color who are trans are not comfortable going to the doctor, are not able to get the same care they deserve when they go to the doctor, which means if you hurt your neck in a car accident, you cannot get the help that you need. And what else are you going to do? So, and when you take into account the fact that we all know that poverty rates are higher, that all of these things exist together, and you can't then wonder why these are worse problems in the Black and brown community. Like, it doesn't happen in a vacuum. It happens because we as a society let it happen, because we had legislation that was based off of racist views on drugs, and we let that happen. So I think like the approaches we're taking now that we need to continue taking are to elevate Black and brown voices and to elevate trans voices and to let those lead conversations and to listen to those and to really go to policymakers and say, hey, we have a lot of data as to why this did not work. If that's what you want, we have even more lived experiences. You either do this or we're going to run for office and do it for you. And I think that's a really powerful thing happening with a lot of people right now, which is exciting in our community. It just needs to be a little bit more outside of our community so we can get there. But I do think that National Harm Reduction Coalition is doing a lot of work around lifting up Black and brown and trans voices in this. And there's very slowly becoming the shift that's like, maybe white people aren't the only ones dying. And like, then we need to step back and take a look at why that is. And yeah, I think, did that answer your question?
Yeah, you absolutely did. I think that's opening up so much for me, especially because I personally currently live in the DMV, Washington, D.C. area. And we have experienced so many Black, transgender, gender nonconforming, queer individuals over the past, young individuals, talking about between the ages of 18 and 35 over the past year, who have passed away because of some type of drug-related overdose. And it's not seeming to get any better. And I think that people are now starting to want more information. But the actual the fentanyl being involved in a lot of the drugs currently because of the things that happened around the pandemic, and not having access to as much drugs is a major issue. So how can we make sure, Michael, I know that you are coming from a perspective of actual educating folks around opioid use. How do we make sure that this information is actually getting to the communities that it should get to, specifically more, of course, we're talking about transgender individuals, transgender and gender nonconforming individuals. How do we make sure that they are actually getting the information, and that it is being received and retained and actually acted upon?
Mm-hmm. Really an excellent question. And I think that I want to start by saying that whenever I think of, or whenever I think of drug usage and someone using drugs, I think about why they are using, why they may be using, and asking those questions. And oftentimes when you think of trans communities, or you engage with trans communities and non-binary communities, you have a significant amount of minority stress that is occurring. Harassment, bullying, violence. As you know, we've had tremendous violence in DC related to trans women in the city, and that creates a need for people to, in some ways, dull that pain that they may be experiencing, or they could, the seatbelt example, or the car accident with the injuring your neck. We know through research that Black communities are prescribed less opiates when they really need them compared to white individuals, based on bias that exists within communities. So one of the things that we first need to do is we need to make sure that we are engaging the community in this conversation, that we are working with groups and organizations like the National Trans Visibility March to reach the communities that need to be reached. That is such an important piece. And making sure that the services are trans and gender nonconforming, accepting and affirming. We shouldn't have fear to access services based on our gender, our sexual orientation. We should be accessing services for the service, not wondering, gee, what are they going to call me? Are they going to call me by my right name, use my right pronoun, etc. at the office? So those are really important pieces. Making sure that the services are trauma informed, because the community is experiencing trauma. It has experienced trauma. And when you think about minority stress, and those extend for generations. It's just not the person in this point in time, but that is passed from one generation to the next. And it's 2 or 3 generations out before that stress is relieved. And there's probably new stress that is coming to bear by that point. So those are really important pieces. And we need to design programs with the populations engaged in the designing of those programs. Whether that is a young person, a trans person, people of color, they need to be at the table saying what's working, what doesn't work, what voice do I need to hear, what messages do I need to hear, and how do I need to hear it. These are all important things to making sure that we reach community, and to get this message out. Yeah, definitely.
Yeah, it's so important, and I think that we oftentimes see a lot. We have seen a lot of folks who have been in charge of making decisions on behalf of individuals without like their lived experience or lived expertise actually informing
Yes.
that. And that is something that like I would like to see shifted, not just in as it pertains to drugs, but like in every single arena, right? Across every single thing. The folks who have the answers to the solutions to what could actually work and be effective and reach those most marginalized individuals, or the folks who are most impacted by that said issue.
Right.
Um,
The one thing I didn't say, and I should, because both Courtney and Thomas brought this up, but we need to make sure individuals are in leadership positions within these organizations, within government, that are the policy makers who are making the decisions, that they're represented in those positions. It's not just I'm getting your voice and I'm incorporating it into this, but we are promoting people and giving them not only a sense of self and purpose, but we're elevating a community as well. And that's one of the things that is definitely, I neglected to say in that last piece, that is really important to do.
Yeah, and the point around policy is definitely important. And coming around to you, Thomas, I just would I want to know. There's so much harmful drug policy. Majority of it is harmful, and the majority of it has been put into place to be punitive and reactionary, and it's not something that's actually sustainable. And making sure that people are getting in spaces that are like helping them and meeting their needs. So what are some of the things that we should be paying attention to as it pertains to policy? Folks who are advocating on behalf of folks who engage in drug use. What are some of the things that we should be paying close attention to as it pertains to policy? Is there anything coming down the pipe? And what do you think is necessary in order for there to be a true shift as it pertains to policy around drugs?
And so I think we need to recognize the war on drugs has become a war on communities, and so we have to end the war. And we need a government that's not a conservatorship, but that is about the people. And those things, I know those are common things we say, but as I was watching with somewhat great interest Britney Spears struggle in court, it occurred to me that some of our policies, like, they fit the same bill. I mean, when we look at the limitations, when we look at maybe the motivations, we're seeing a macro conservatorship, and we got to get away from that. One of the things, Mayor Demings, I was very happy to stay at the university, but the opportunity to work for somebody like Mayor Demings with such a vision and a passion for the work that I do, has it's exceeded my expectations. I've been here for 2 years now, and he's allowed me to think big. So we're getting ready to start a program where when inmates leave the jail, if they've been in our medication-assisted treatment program, we're going to provide them 6 months of intensive case management that includes not just behavioral health care, but we're going to connect them with local PCAN clinics so that they have physical health care as well. Because if you have a chronic disease and you don't have a primary care physician, and so that's just a simple shift, but to be able to to have the energy and the excitement. So yes, go make that happen, and we'll put money behind that as well. It's not just it's not an unfunded mandate. It's it's a funded opportunity. And the other thing, I just briefed Mayor Demings this morning. We're looking at what's called a post-overdose response team. So when our fire rescue administers Narcan to the same person, 7, 8, 12 times, we're going to have a case manager who goes out to that with fire rescue after the fact and checks to see if they've got access to services. Because if they're getting Narcan, multiple times in a 6-month period of time, then it's important to find out why. What are the social determinants that are happening there? And then beyond that, we're going to have that same case manager with someone from our fire rescue department go out to businesses that have had multiple overdoses in those addresses. And we've put together a workplace toolkit that's basic information of how to recognize an overdose and what to do, and then to provide them Narcan for their first aid kits. And then lastly, looking at those communities that are engaged, part of the post-overdose response will be a street team, so that we'll go to those communities, we'll speak with faith leaders, we'll do door-to-door stuff to get the word out, what the resources are. And so, it's that kind of leadership that I think is needed. And while that's not necessarily a policy shift, I think it'll eventually lead to one. When people see the value and they can, it becomes tangible. It's not just a great idea, or it's not something that's happening in another community. So, yeah. I don't know if that answered your question.
Yeah, it does. And it gives me a little bit to think about as well. Yeah. So one of the things that I think is so important as we approach tomorrow, which being the actual celebration of National Trans Visibility March, and knowing that the transgender community, the TGNC community overall, has a very familial approach to the way that they do stuff, and are all about chosen family. And it has honestly been our response to a lot of things. Us being cast out of our biological families. It's been our response to the HIV epidemic. It's been our response to the struggle with addressing drugs and everything. So, how much do you all think that community has to do with being a solution to this epidemic? And how can we work to really strengthen that? And I mean, strengthen by actual financial investment, physical, emotional investment. How can we strengthen that chosen family, familial aspect that it exists in the TGNC community?
Go ahead.
Yeah, I think one of the first things that we need to do is work with those people who often respond. We just did a training for first responders on resilience and burnout prevention and compassion fatigue. That's one of the things that I've seen in some of the discussions I've had with law enforcement is that there's this question of, why am I giving someone Narcan over and over and over again on multiple occasions? And I use the analogy that if somebody was drowning and you wouldn't ask them why they didn't learn how to swim, you'd save them. And just the reality is that it typically there's multiple relapses once somebody gets in treatment, but even getting in treatment can take a long time. And so, kind of understanding that there's some seeing compassion and being able to avoid stress and burnout from those people who are having a direct contact with some of these, the marginalized communities. And that, it's important that those people who are perceived as helpers, that the help is perceived as helpful. Mm-hmm. So I think that's an important piece from a policy standpoint, from a personnel standpoint.
So there's this thing, if I'm sure everyone on this panel has seen it, but if anybody watching has not, there was a study done around addiction called Rat Park, where somebody stuck a rat by itself in a cage and gave him regular water and water with cocaine. And that rat just drank by himself, no rat toys, no nothing. That rat just drank that cocaine water because he was bored. What else was he going to do? And then you put a rat in Rat Park where he has other rats and he has toys and he has good food, and you still put the cocaine water in the normal water, and 90% of those rats were not interested in that cocaine water. And that kind of goes along, it's a very long way of explaining that the opposite of chaotic addiction is community. So people knowing they have family and resource and not feeling isolated because they're using drugs or because of how they identify or because of who they are is a huge, huge part of stopping somebody from using to their detriment or from overdosing and dying. And then I think when it comes to how to actually help large communities and not just one family or even one family, we have to talk about reparations. We have to talk about why there's a police station on every single corner, but not a community center. We have to talk about the fact that communities are being over policed and don't feel safe and don't have enough money, and they need more money to have community centers and schools that are up to standards and good teachers and jobs and all of these things that really impact drug use or not using drugs. So financially, we need to just put money where it's always needed to be, which is in underserved communities, which are over policed communities most of the time. So where most of your police, great, give them more money. And why is it that we have a bunch of empty buildings, but probably a lot of business owners who would love to have that idea, but don't know how? So how do we teach people how to own businesses? How do we give people that literacy and that competency? How do we have programs that teach people how to exist in ways that aren't just college? Because maybe college isn't for everybody, or maybe financially they can't afford college. Or how do we get them into college if they can't afford it? Because I personally will be paying off my creative nonfiction degree until I die because college is so expensive. So it's a lot of different things, but it starts with letting folks know they're not alone, and then it starts with giving folks money that they need at a community level to actually rebuild and get what needs to be done for them.
Yeah. So I have one last sort of existential question. Who's winning the war on drugs?
Nobody.
Yeah.
I personally think that the war on drugs is probably doing exactly what it was made to do, which is over police and not care about communities. So nobody's technically winning, but also I think there's a lot of people making a lot of money off of arresting people and not giving people the help they need, or not allowing people the help they need if they can't afford it.
Mm-hmm. I actually think there is no winner in this situation at all. We're losing because prevention and services like harm reduction are inexpensive compared to healthcare services, compared to someone ODing and needing to be on a ventilator and to breathe. We're not doing enough to educate folks around safe and effective use. These are things that should be part of our learning and our regular culture of growing up. You know, when people go to college, there's an assortment of substances, alcohol that they may not have experienced in their own community. But how can you do that and use that appropriately and be safe and, you know, have that experience if you choose to do so? I think that is, you know, really an important piece to focus on. We're losing.
And off of what Michael said, that's absolutely from a baseline cost perspective, that is absolutely right. I love telling people who have some weird moral thing around drugs how much money they're going to save by implementing harm reduction. Orange County spends $30 million a year on abscess and wound care in hospital settings because people who are using drugs don't have access to healthcare or clean needle. Now they have access to clean needles. Come see me. But before, didn't have safe access to clean needles. So I love to tell folks that you save a lot of money and you don't even have to really care about what people are doing because you're saving money. And isn't that a nice thing? I also think we lost Caleb momentarily.
I think maybe we did. I just wanted to touch on something that Thomas said around policy and policy issues. I think that one of the most important things is that healthcare reform, the ACA, has been under attack since its inception for repeal. And that law gives protection and gives people access to plans that they can access substance abuse services as well. If communities have not repealed paraphernalia bans, they need to work toward that. The fact that you're carrying a syringe, you're carrying naloxone, that's not a criminal offense for somebody. We need to make sure that that's happening, that Good Samaritan laws are in place that allows people to call 911. I believe there are only 40 states in the country and the District of Columbia that have a Good Samaritan law that says if you call 911 for someone who's overdosing, you're not necessarily going to get arrested if there were drugs there or something like that. We need to make sure that those pieces are in place. And a lot of that is going to take one of the most important pieces of policy development, and that's your vote.
Yeah.
And to register to vote, to be informed about these issues, and to go to the polls and vote for leaders that represent you and represent the communities that we live in. That is an absolute essential thing around policy that we need to make sure that people are aware of, and they have the right to do so and need to execute that right.
Absolutely.
I want to tag onto that real quick. We need to think of that in terms of the local level. It's not just a state representative. I mean, we're talking the school board. We're talking the commissioners. At the local level, there's some people have with their agenda have figured out how to be more active in getting involved at the local level. And so I think it's really important that our voices are heard at the local level, because we're the people that are making those decisions, instead of having the decisions made for us and then trying to push back against those. I do want to mention Florida has a 911 Good Samaritan law. It was enacted in 2012, which is shocking. However, I was meeting with a group of Black pastors recently, and they hadn't heard of it, which made me wonder how applicable it was to their community, since they hadn't heard of it.
Yeah, that's something I actually I discovered existed this year, like just in general. So I think that that's something that definitely could benefit from doing a little bit more intentional outreach into communities. It sounded like I dropped off for a minute there. It sounded like folks were doing kind of like call to action. So yeah, if there was anything else that you all wanted to add around, like what are some of the next steps that people can take if they want to be able to support someone in their community or do better around drug use generally? Like I heard you talking about registering to vote, actually following through to vote. Michael, is there anything else that y'all wanted to add to the folks that maybe want to get involved or want to support and don't know how?
I think there's a ton you can do. There's a ton we can do in Orlando, but I will not shamelessly plug the Syringe Exchange any more than I already have. But we do have a Syringe Exchange. We love volunteers. I think that if you're interested in knowing more about how to help folks using drugs, Google where to get Narcan in your area and start there. It might just be the health department, so maybe wonder why that is, or ask if they have any other programs. It might lead you to some really cool programs that you didn't know existed. Yeah. National Harm Reduction Coalition has amazing resources. They have language guides on how to refer to folks using drugs and what words to use and not to use. There are so many amazing syringe exchanges that have extremely informative social medias around the country. There's a lot of work being done by people on the ground to have a national conversation around empowering and centering people who are directly impacted in the war on drugs. And they're willing to put a lot of free labor into it to educate people if needed. So look them up. There's a lot of really incredible student exchanges, and they have a lot of really incredible resources. But find Narcan, and if you can't find Narcan in your area,
well, you can call me, and I'll find Narcan. We've distributed over 21,000 doses of Narcan since 2017 to local law enforcement, to hospitals, to individuals. And so, there's a commitment on our part to make Narcan available. So get involved. There's many communities have coalitions. There's all kinds of opportunities to work on the coalitions. And so I think it's important to make that, pick up the phone, make those calls. It's Google.
And I would just add to properly dispose of opiates that may be left over from that dental procedure or that broken bone or whatever that you have, by taking them back to the pharmacy, and they can dispose of them. Many places have a bin that you can put them in, that they will be destroyed. And I think making sure that you carry naloxone with you, or if there is someone using an opioid, to make sure that naloxone is available for use. And overdose doesn't happen just because someone uses an illicit drug or something. Overdoses can happen with the medications that you get from your doctor as well. So being prepared, just like you would for first aid or CPR training, this is something that's really important. And having the conversation with your friends about the stressors that you're having, that sharing those experiences, and showing healthy coping skills is also really important to do.
I also want to add on to what Michael said.
I want to jump in. We need fentanyl, or we need opioid test strips, because there's so many.
Hope and Help has fentanyl testing strips if you need them.
So many people are taking opioids without knowing it. Whether it's a fake Xanax or Adderall pill, whether it's cocaine or methamphetamines that are contaminated with fentanyl, it's real and it's happening. And Gen Z students when we reviewed the data for overdose deaths from Orange County from the medical examiner's office, we found that of the Gen Zs, 93% who died of an opioid overdose, which was much higher than the baby boomers and the Gen Xers. And so we've got to get that message out to young people that prescription pill you think you're taking may be just fentanyl straight up.
Yeah, I was literally going to say exactly that people overdose on opioids when they're not taking opioids anymore. Polydrug use is one of the main. We are an overdose crisis that is being exactly intertwined with an uptick in stimulant use that have fentanyl in it. So even if you don't think you need a fentanyl testing strip, even if you're doing coke, even if you're doing Molly, even if you're doing that pill, it probably has, or it could have, fentanyl in it. So just test it. And if you're going to use something that has fentanyl, know how to do it. Use less, use slower. Make sure you have somebody with Narcan on you or on them close by. It's not realistic to think that people aren't going to use their drugs just because there's fentanyl in them, but we can at least equip people to know that there is and know how to stay alive while they're doing it, which I think is just as important. And one of the things that I know Hope and Help is going to be working on is getting bars and clubs all the access to Narcan they could possibly need, and teaching them how to recognize overdoses, because it is impacting younger communities, because younger communities use stimulant drug use. I can tell you what I was doing in my 20s, and it was a lot of stimulants. So it's an important conversation to be having. And fentanyl test strips do need to be available everywhere. People need to know that they can get them free of charge, judgment free. You call. I'm not going to put my name in this chat. I mean, my phone number in this chat. I've gotten in trouble for doing that before. But call Hope and Help, and we will give you a fentanyl testing strip. I am the stimulant girl at work because all I do is talk about fentanyl being found in stimulants because it's a huge, huge thing that people don't think about when they're going to use a stimulant, and that makes me very stressed out because, like Thomas said, a lot of young people are dying from overdose, and it's probably because they're using substances that they don't think are going to have opioids in them, and they don't know what to do. And if you're using Molly in the Orlando area, there is probably fentanyl in it. So please test it. That's a huge thing happening right now, and people need to be informed that it's going on, or else we're going to just keep seeing this continue.
Mm-hmm. Yeah. Thank you so much. I really appreciate y'all for this conversation and being so intentional and mindful and being dedicated to this work. It's so important, and I appreciate the aspect of community and the perspective of making sure that folks have connections to individuals that they feel like are caring about and supporting them, and just the whole notion of like the naloxone itself, like it requires community, right? And that's what the National Trans Visibility March is all about. So I really appreciate you all. Thank you so much for this conversation today. I feel like it was a really rich dialogue. And yeah, I look forward to seeing wonderful things in the future as it pertains to us eradicating this epidemic.
Thank you. Thanks so much for
Yes.
to the National Trans Visibility March for even creating a space to have this conversation.
Yes.
So thank you for that.
Thank you. Appreciate it. So Ashe, thank you so much. Everyone,
thank you.
Great weekend. Take care.
Bye.
Over the past few months in the Washington, D.C., Maryland, and Virginia areas, the Black and Brown, queer, transgender, and non-binary communities have experienced multiple different losses to substance use. Individuals directly and indirectly impacted by this issue all came together as a part of the National Trans Visibility March's Community Advisory Board to create a campaign to raise awareness about this issue. Those individuals created a campaign titled Our People, Our Purpose. The message behind this campaign is meant to promote the necessary community that individuals need: family, chosen family, biological family.